Hi.
Hi, Bob. So many patients have been asking about the history of Now Hear This. Do you have a few minutes to talk to me?
Sure.
Great.
Sure.
All right. Well, Bob, you're the founder and the CEO. Can you tell me how you got the idea for this?
Well, I had been consulting with a German company by the name of Accufit for several years. They had invented this device for the hearing aid industry in Germany, and they asked me if there was an opportunity in the United States. We found out that there was. We decided to get FDA approval, so we got that. And then as I started looking around, I discovered that the people that would use this device were excited about it, but what I really found out was that the patients, hearing aided patients, were really just unhappy with the performance of hearing aids generally. And I thought, wow, this is not only an opportunity for the ACAM and for this device we got FDA approval on, but there was a niche in the marketplace for a new hearing aid clinic, and we named it Now Hear This.
So tell me a little bit more about this miracle machine. What's it called again?
ACAM.
The ACAM,
yes,
okay.
Right here.
Ah,
yeah.
great. So that's the ACAM.
Yep.
And tell me a little bit more specifically about what it does.
Well, first of all, it's not as big as that. It's essentially the size of someone's home computer, and if you came into our fitting room, you wouldn't even see it. It sits down below the desk. Our audiologist uses it, and it essentially brings technology to him, some new tools, so that he can do a better job of understanding a person's hearing, and then figuring out which hearing aids are going to be best for him or her, and then fitting them and fine-tuning them, tailoring them exactly so that they work to their maximum performance, so they can hear comfortably and clearly.
So it sounds like you're suggesting that you can do a better job than anyone else out there. If a patient were to come here, what's in it for them? What benefit do they get?
And what's in it for them is that with our device and with our operating philosophy, they can get their hearing aids fitted more accurately and in less time than what they might at somewhere else. We use something called real ear measurement, so that we can actually, after we fitted the patient to the hearing aid as best we can, then we've got this technology called a real ear measurement that actually allows us to measure the output of that hearing aid in that person's ear canal.
Real ear measurement. Can you tell me a little bit more about what that does, or how that ultimately helps the person? It seems to be something that we're hearing a little bit more about now in the audiology field.
Without getting too technical, essentially what it is doing is it's accounting for, it's a technology that is meant to account for each patient's individual ears and how they perceive sound, and the size of their ear canal, the diameter of it, the length of it, the shape of it. And that's a really important thing to do for any hearing professional, and we do it on each and every patient.
Mm-hmm. And I know one of your technologies is called Accufit. Can you explain Accufit a little bit more? Accufit
is our overall approach using the ACAM, the real ear measurement, and some other technologies such as hearing and noise tests and acceptable noise levels. We believe in doing more testing rather than less testing, and with the benefit that while the patient, we're doing a little bit more in the first couple of sessions, the patient winds up not having to come back as often and doesn't have as many complaints about their hearing aids as normal.
Well, great. All right, Bob, I know you've got lots going on, so I'm going to head out of here. Thanks so much for your time, and I'll see you around the office.
Good to see you. Thanks for the questions. Talk to you later.